know there's someone in the background. There we go. We're live. All right. Well, welcome everybody. My name is Dr. Harvey Castro. I'm really excited. This is actually a little different. Usually Junaid's here, and today he needs a little break, so he's off the next 2 weeks. But we have Ed Marks, and then we have last week's guest, which I'm really excited that she came. And today we have Yishi, and I'm excited to hear that you're from Germany. And I'm gonna let you just introduce yourself, your background, and tell us about yourself.
Oh yeah. So. As you mentioned, I'm from Germany. I did my undergrad there in medical engineering. That's where I developed a passion about image processing. So the journey brought me to Singapore, where I did my PhD in metabolic imaging, advanced like AI-based image processing, very focused on segmentation, which is, I believe, today's topic. So I'm currently a postdoc at the Oxford University, Radcliffe Department of Medicine, Division of Cardiovascular Medicine. So my focus is on precision phenotyping, mainly on imaging-based precision phenotyping to understand, but also to advance, kind of like develop tools for precision phenotyping, cardiometabolic risk.
Excellent. Wow, you've done a lot. I like how well-versed you are, living in Singapore, German. I've had the pleasure of being in both countries last year, so that was a lot of fun. So let's just jump right in. What personally excites you the most about your field? Like, how are you're doing a lot, and what can you share with us?
Yeah, I think it's the combination of different expertise I had the chance to acquire during like my journey. So as I mentioned, I started very passionate about computer programming, image processing, because like images are always something very tangible, like you can visualize them, so you can really understand what you're working on. So yeah, that is where the transition between, I think, the engineering part, the AI development part, towards also understanding the human body, and specifically for the current passion I have towards precision phenotyping is because like it really enables to look into details, changes over time if you have longitudinal data, so you can really understand kind of the medical part of it, like the biology, from a very visual point of view, and then bridging that with the technical skills. That is, I think, something that excites me and that makes me really like passionate about like merging two fields together. Yeah.
Yeah. Well, the exciting part about this particular panel of all of us here is we all have different spins. So I know everybody's brains are already like jumping based on what you said. For me personally, I'm always excited about what's tomorrow. So for me, what really you think is something that's going to happen in 5-10 years from now? You're like, oh my gosh, Harvey, this is going to change humanity. This is what's going to happen. I'd love to see what you, from your angle, what you see. No pun intended.
Yeah. Of course, yeah. This answer is going to be very focused on I would call it my niche area. In that sense, I think if we think about like huge hype currently in terms of the obesity pharmaceuticals, right, and the transforming landscape, how they revolutionize kind of just not care about obesity, but also cardiovascular management. And I think we are currently understanding that a lot of diseases, for example, like heart failure, are more and more multi-system diseases, and this kind of like phenotyping segmentation, which is like a kind of like a fundamental pillar of like looking into the whole body at a structural point of view. Of course, then with advanced techniques, you can also get like information more on a qualitative imaging based features. But then I think it is towards more precision medicine in that sense, understanding body composition, and of course then having these AI tools enable that in terms of like discovery in large data sets. Because, for example, these current medications show that they have multi-system, kind of multi-organ like effects, right? So I think through these advanced tools, we can really look into the whole body rather than isolated kind of look into disease. Yeah.
Yishi, you have all of our minds just going now with these concepts that you're bringing up. And just to give you a little brief background about me. I'm a pediatrician with 15 years of clinical experience, and I recently kind of dived right into entrepreneurship in this past year. And I guess I've kind of come into this world as a bridge when it comes to AI, kind of like a bridge between those that are at the forefront of the tech and those who don't even know anything about the tech, but they surely will be impacted by it. So, one of the things that I thought of as you were speaking is, Harvey talks about this when you think about the why, which is the patient for a lot of us, or at least one of the whys. I think of, who benefits the most from this technology? Who does it help the most, in your opinion? And how can we best kind of make it accessible to those who stand to benefit the most from it?
Yeah, I think, yeah, I think there's going to be a shift. I'm just going to make an example for let's say BMI is a very crude way, but it is a risk assessment tool that goes into so many risk scores, matrices, and it is mainly also because it's very accessible, right? And it's easy to measure, cheap. So obviously these AI tools which enable like high resolution segmentation, let's say from MRI data, might not be the way if you think about the clinical screening tool. So the question is always like how and where what kind of research is needed to bridge this kind of gap from discovery towards something that is really going to be useful in clinical practice. If it's going to be prediction or diagnostic purpose, the roadmap will change and the utilization, of course. So yeah, I think that's pharmaceutical development. I think there's also huge use in terms of like precision. So I think one step would be these tools will be more and more used in pharmaceutical development, and then once they are established in that space, they can be maybe proven useful in clinical kind of practice. Yeah.
Hey, Ed, what are your thoughts from an administration point, or from just from your angle, Ed?
No, I love this. Obviously, we're we're part of this podcast. We're always sort of thinking out in the future and how we can leverage technology and bring about better care for the community and people that we serve. So no, I think it's super fascinating and would love to see something that like this at scale and helping everyone. I've been spending a lot of time more recently in parts of the country and parts of the world that are much less populated, and actually they have a greater need for these sort of capabilities. So what are your thoughts around just the scalability, making this available to anyone, whether they're in the big city or perhaps out in remote Bavaria, where I'm from originally?
Yeah. I think scalability is something that is like moving from, because we talk about segmentation and we talk about normally imaging data that forms the basis of discovery, and then as a tool, the question is, can we find proxies like molecular markers? Maybe that can also be like cheap or like anthropometric measurements, for example. They can proxy something that is captured in high quality data before. So I think there's a huge question in terms of more remote areas where I think digitalized kind of care or like remote kind of access to sending kind of information into remote areas might be challenging also if we talk about imaging data, sharing data, right? I think that is also a big challenge in terms of like infrastructure.
Interesting. Not to put you on the spot, I'm curious if anybody, I'll just leave it to everybody open. Has anyone seen the new Midjourney device that they're promoting and that they're talking about? If not, I can kind of share it with everybody. No. Okay, the reason I mention it is big picture. They created a ultrasound type of machine that you go in and you immerse yourself in water, and then it's able to see your organs inside. And Midjourney, being able to regenerate what that image looks like, they're able to show you this is what's going on inside of your body. What they're planning on doing, which I think is so smart, they're going to start in San Francisco next year because they're from the Silicon Valley area. But what's amazing is they're going to put it into a longevity clinic, and in that longevity clinic, we'll have, your peptides, your GLP-1s, your saunas, your red lights. But from what we're talking about right now, I think, oh my God, here's amazing. You're coming in, you're getting data, you're interpreting that data, you're hopefully doing more predictive analytics, and now you're doing prevention. And so that just blew my mind. And so then hearing what you're doing, I'm thinking, oh my gosh, take that to the next level, add a 3D printer ability, and boom, now we're actually printing personalized care for that particular patient. So jump right in, your thoughts, anybody? Or we can keep going to the next one. Go ahead. I can see Ed was going to say something.
No, it was very thought provoking, right? And very, very future oriented. But I think we're getting, as we know, because of AI and great thinkers like Yishi, that I think we're going to see the fruition of a lot of these things in application a lot sooner than, perhaps in the past when we waited years and years and years. And I think now, it's unfolding in front of us in real time. So I'm really encouraged by that.
So let's jump in. I'm sure, I know there's been some emails going back and forth for text. Just tell us more about what you're currently working on that you could share with us that you see advancements in that side, or things that you've seen in the field that the last couple of years wasn't even around.
I think I can start a little bit about sharing what I've been working on in Singapore. So the focus was adipose tissue, so fat segmentation, fat distribution. So I think, as mentioned earlier, it's like we are at a very crude way of dealing with obesity, which is such an important topic to tackle in terms of a public health challenge. So I think that the way to go is also there's literature, obviously, to understand that fat distribution is very important to take into consideration in terms of risk assessment, but also like the development of specific diseases, so precision risk assessment. And I think that there's a lot of potential in terms of AI solutions to enable that into understanding fat distribution better, but then also, as mentioned earlier, we need to see how can we bridge this challenge in terms of gold standard assessment, fat distribution, to more like accessible solutions. Anthropometric measurements are there, but they are quite limited. So I'm not sure. I think it's quite a challenging pathway to see how we can bridge that. But obviously AI solutions are there, kind of paving the path for optimistic solutions.
No, I love it. I last year I did a TED talk on basically reactive medicine to proactive medicine, and this lines perfectly with what you just said, in that if we're able to catch people way early and predict, given that you have experience in Singapore, you could relate to this. Every citizen in Singapore, they have their genes, and they've done I won't say an experiment. They're looking to say, okay, we have this data. What do we do with it? And they've done a couple of things, but one I like to highlight is they did hypercholesterolemia patients, and now they're identifying kids at birth saying, hey, this person will have a heart attack in their 20s and 30s. This person will not live as long. As a result, what can we do as a country? And they're looking at the genetics, calling these individuals and saying, okay, let's observe you, let's see what we can do, and let's put you on medicine before your heart has damage. And I'm thinking, wow. So basically, like, your research goes in line with that same theory. Now we're going away from that reactive medicine and more to that proactive medicine. And then on the personal side, unfortunately, my dad died of a heart attack, and he literally had no warning signs. He just had a heart attack. And on the flip side of that, my mom had thyroid cancer, but she's an ultrasound tech, and she was able to scan herself, and one day just luckily found it. And to me, that's proactive, because she found it early, she got on medicine, and she's alive today because of that. If not, she wouldn't be here today.
Yes.
When we have conversations like this, I get excited because this is such an amazing future to look forward to where we can be more proactive about just, identifying things early, identifying risk factors early. And, there's still a lot of tech that's in development. Well, aside from like the accountability of the technology itself, what do y'all think are the big barriers or the timeline to where we can realistically see this in our clinical practice?
Yeah. So I think since I'm coming from a very research perspective, one thing I always want to keep in mind is how to exactly bring it into action, and then what is the timeline developing those products. And I think a big opportunity is always to see what is currently there in infrastructure and can we hop on it. For example, coming back to my domain area, is like MRI imaging is the most standard way to capture fat, but then there are routine imaging, let's say angiography images, but where we could maybe also assess markers. And I think there's been recently also kind of very interesting work on mammography data, where they also can find associations or like risk prediction value from those images for cardiovascular events. I think if there are standard screening protocols for certain conditions, we can also now think a bit broader with AI. Can we get more information out of those which already are done on a clinical routine, and then transform them into higher value products?
Yeah, I appreciate this work coming out of Europe, and as we know, there's a lot of innovation coming out of Europe and places outside of the United States, and the frustration inside the United States with technologies like this is that even when available, that they're not utilized proactively to the level that we'd all like to see because of the economics of our healthcare system, and it's very frustrating. So I was with some executives from an organization called ChenMed here in the United States, and they do what we call value-based care, and they do want to be as proactive as possible. And what you're doing, this is exactly the sort of technologies they would deploy to keep everyone proactively healthy, because in the long run, not only is it the right thing to do for people, but in the long run, it saves a lot of money. But there's other, the majority of our healthcare system where it's not like that today. And so there's no incentive, unfortunately, for this capability of being super proactive. But I love it. I'm hoping that with more technologies like what you're developing and doing research with will help, overcome and push leaders into the realization that we need to do this, because one, it's the right thing, and number two, it really does economically save a lot of money when you can be proactive in medicine. And that's why, what Harvey talks about in Singapore, which is nice, confined geographically small, they're able to do a lot of these sort of things and just prove out the use cases. So I know I'm super excited, and yeah, we're always banging our heads around this. Like, how do we bring these sort of technologies to bear in our country when the incentives aren't there yet?
And how does something like this change how we're reimbursed? Because that's always a conversation that is evolving, and it's usually not a good conversation when it comes to the physician side of things. But there's a lot of things to consider there on the economics of it.
Yeah, I apologize. I have some background noise. I'm gonna let you guys talk until they finish, and I apologize.
That's the fun part of doing live shows, Harvey, and I think we all deal with it. I'm usually in a hotel room, as you can tell, and but it's all good. It's super fascinating. Yishi, so what would be sort of your vision for the research that you're doing, the capabilities that you're developing? How would you, like, in the ideal state, when you think about this, it's got to be your motivating factor, right? Like, what is it that you'd love to see in the next 1 to 3 years?
Okay, well, 1 to 3 years. Okay. So I need to be realistic, right? 1 to 3 years. I really think, so I really want to shift the field in terms of body composition, understanding how important is body composition, whole body kind of assessment with respect to specific diseases. Obviously, my focus is cardiovascular diseases and cardiometabolic diseases. I believe for my research, it's like the transition would be going from advancing the development of pharmaceuticals in a precision medicine approach to more specialized phenotypes. So, for example, if we think about sarcopenic obesity, right? So we have like now this huge these incretin-based agents, but then we know that they have huge benefits, but at the same time we are slowly only now understanding how complex body composition actually is. Like there can be people who are obese, but at the same time they have sarcopenia, so they have loss of muscle function. And then I think you going more into precision phenotyping, there are a lot more subtypes. And I think one of the challenges, the more data we have, the more we understand how heterogeneous our population is, and the more challenging it will become to go into precision medicine. I think that that's kind of the challenge with it. But then realistically, to advance the field, of course, we always have to anchor back to how currently the healthcare system works. And in that sense, I think a lot of these tools could be complementary. For example, if there is a general screening and how do you want to prescribe medication, like guidelines, maybe there can be advancement with AI tools, transitioning slowly into that ecosystem to maybe first private assessments, but then of course, if we can prove to larger trials with collaboration with pharma companies that we can really target people better through imaging, maybe that is a way to get that into clinical practice as well.
So instead of spending time and potentially risking your health deteriorating in the meantime, trial and error with different medications, more clearly off the bat what to treat your patient with.
Yeah.
And to piggyback on what you guys are saying, two things. One, to be able to do this for entrepreneurs, our government needs to have some kind of CPT code, something that they're going to get reimbursed for it. If not, they're not going to push for these things, unfortunately. Right. And I get why. The second is the culture. I always talk about that. We need to make sure that us physicians, healthcare professionals understand this technology and the governance and all of those things are in line so that we can use them. And then the other part of this is the workflow. If these things exist, but I have no idea, and it's going to be 10 more clicks for me to do it, am I going to really do it? So it's important to do all of that as one.
We're talking a lot about this in terms of population care and taking care of people who are already obese in this specific example. Mm-hmm. But what about, since we're talking about World Cup a little bit, what about from a proactive athlete point of view? Like, have you thought about or seen use cases where this can help someone have optimal performance?
Yeah, I think I haven't seen. Okay, I'm not very aware of what is going on in that field, since that's not quite my area. But I think obviously like body composition, and like if I'm talking about like body composition, it's not just like looking at like a muscle mass, lean mass, but also like we're talking about metabolic health. We're talking about like skeletal muscle health. So I think this is a huge opportunity to look into general health like assessment. Predictive model in medicine are also more in sports medicine is more and more used in terms of making sure athletes are fine. I'm not sure if that's exactly what you were touching on, but the huge topic currently also is the biological aging, and I think there's also a huge market in terms of looking into age, kind of biological age based on your body, right? And then in that sense, you can also see how fit is someone compared to someone who is in his same chronological age. Compare it's a different way of looking into medicine or health in general, I think.
Yeah, I mean, I understand that's not your specific area, but as my head is spinning and I think about the economics and how do we get this into the mainstream, and because at least in the United States, because of the way we pay for healthcare, it's very hard to get great technology like this into the mainstream. And so sometimes it comes in through the people who are very interested in longevity or their biological health, or from an athlete point of view. And then it gets more publicized, and then we see more results. And then finally, we're able to bring it to bear for the population that really needs this sort of capability. That's why I ask out of curiosity.
And I'll shed light to that. I've been working in that field. I've been working on some digital twins for what you said on the athlete side, and I'm helping some companies with this as well. Basically, what big picture, since I'm seeing it, several companies doing something similar I could share. They're looking at the data analytics, what's on the wearable, what's going on, and they're being proactive to saying, okay, this athlete woke up with the HRV of XYZ, they did this, and you're pushing them and it's hot outside, and because of that, you're going to injure your player, and they have a big game in 2 days. And so let's adjust. Or looking at the data analytics and saying, hey, this patient, drug, they're sweating XYZ, certain cortisols and some electrolytes. We need to replenish them at this point and that point. And so it's becoming really interesting and fine-tuning. And then companies are working on that whole predictive analytics. Can we say if athlete will be at their peak, but if we're pushing them, are we also seeing a decline? So it's interesting how this is affecting sports and games like World Cup.
And so more
and recovery as well.
What's that?
No, recovery. I'm just saying after injury.
Yeah. It seems like the applications are like acute as well. Like day to day, they're kind of managing, athletes from one day to the next based on what their composition is. And that's very interesting. And, I always think about my patient population on the pediatric side. And we know, typically things tend to trickle down later on into pediatrics, but, do you feel like some of this could apply to the even younger population? When we talk about proactive medicine, I mean, that's getting really proactive, is applying this technology to pediatrics.
So actually in Singapore, I worked on a birth offspring cohort looking at fat distribution at early stage. We actually see there that the fat distribution patterns. I'm not talking about obesity. A lot of times if people talk about fat, they think about obesity, and then the disease onset is later. But then obviously there are metabolic consequences before someone, or even independent of general fat accumulation of adipose tissue. And that reflects also lifestyle and other factors. So in that sense, I've worked on this cohort in Singapore where we looked at the children, and at early stages already kind of fat distribution matters in terms of their longitudinal health metabolic markers. Of course, it's a bit hard to have prospective outcomes that matter in terms of cardiometabolic health that establish later in life, which we know are chronic diseases. But we see trends, for example, for certain phenotypes having specific risk already developing potentially hypertension, elevated lipids, or glycemic measurements. So definitely there is in the data we can see that these things start very early in life, so that is even below puberty. However, the question is always, if we know that, what can we do, right?
Right. That is true. We think, okay, all this knowledge, this access to knowledge allows us to be so proactive, but I could also see the other side of it. And, patients saying, well, I don't really want to know, I don't know, it being almost kind of scared of the pressure of what that does, and especially as a child, I think there's one of the amazing things about pediatrics is the capacity for change and resilience to develop in childhood. And so it's kind of interesting, if you have that in your mindset from the beginning, that you have risk factors for certain conditions, how does that affect, your actions?
I love this question. It came up recently where all these countries are doing all these medical screening exams on some of the infants, and different countries will screen for certain things. But it's such a good question. If today I don't know, some patients are going to be like, well, I'd rather not know if there's not anything I can do for it. And then the other side of it is some of the parents are like, no, I'd rather know. So now I can research and keep an eye out for what's out there and try to get on some clinical trial. It's really interesting. And I know medical school, you and I probably went through this, and that, you know, we went through certain diseases and they're like, yeah, this is a life sentence on this particular disease. And you're going to depress the patient if they still have 30 years to live and you're telling them that they're going to die.
Yeah.
You know, ethically, what do? Do you tell them or not, or why, or, you know, how do you do that counseling? So it's really, really quite interesting. And now with AI, with so many predictive analytics analogs, I always talk about this technology, this particular technology, everybody seeing this feed, you could have an algorithm to see our age, our hemoglobin A1C, our blood pressure. I mean, there's so much information that can be extracted. And then I know you're big on the governance, so I'll throw this one in there. Being able to interview someone and saying, hey, I'm getting this following feed, and I know this is unethical, and saying, hey, this person's got diabetes, I don't want this person as an employee. I'm going to have to pay them more in health premiums. I mean, stuff like that. How do you fight that?
I think the first part is quite interesting because I think there's a challenge in terms of if we think of from a technical point of view at a company, then as you mentioned, the AI has so many predictive values in terms of proving that it can predict something. But then from the healthcare perspective, it is always the follow-up question, what can be done and what is being communicated to the patient. And I think for a company that focus only on producing a product that can predict something very well in isolation with what is there in the healthcare system to provide healthcare service is an incomplete story. Of course, it might be lucrative from an economic point of view or from a business point of view. But just to give an example, since the topic is also like based on image and image segmentation, like the retina imaging, fundus imaging is marker nowadays established in the literature very strong to predict systemic diseases known through the microvasculature in the eye, and it is a very cost-effective, non-invasive way to look into human health. And then if you look at literature, it basically predicts, you can build the AI model based on those images to predict all kinds of diseases, from cardiometabolic diseases towards neurodegenerative diseases and other diseases. Then the question is, this is a very interesting area, of course, to provide good service if we also have the clinical care that can follow with that, right? Yeah.
I know I recently saw some information coming out of, they have it all over the US, but this one particular case was here in Texas where we're able to do routine retinal scans on individuals and then be able to say, hey, this actual person has pre-diabetic or diabetic glaucoma, and able to jump on it to say, you know what, had this gone unchecked, they would have gone blind. And they were able to catch all these patients because of the algorithm. And family practice doctors that have no real training in looking at that, or even if they could see the back of the eye that well, don't understand. Now the AI being able to analyze, create, and do that predictive analytics and saying, oh, this is what's happening now or about to happen. So excited about this field. I'll share a little hack internally. I'm getting access to some of these algorithms, and you guys are all gonna laugh. I know Big Brother-ish. My camera, I will turn it on. I will speak to it, and it'll give me my age. It'll give me my range of my voice. Before I take stage, it'll analyze and say, Harvey, you are below your average voice. Here's some exercises, here's some breathing things to get you to your peak performance when you take that stage. And so I'm already kind of combining some of these algorithms to help me with today.
That's cool, man.
And, you know, we were talking about these predictive technologies, things that can potentially identify risk factors well before they're clinically detected. And you also think about, you know, in terms of access, is it ethical to make them available to just some people who can maybe, you know, afford the type of technology that's available? Or is it something that we need to kind of, you know, almost like try to make sure it is accessible to everybody? If we're really thinking about, you know, the cost of healthcare long term, as well as, our disease states long term. I mean, wouldn't it serve us all well if everybody had access to it? And then, of course, we can't require people to do this type of testing, or can we? Going back to your question of who you would hire, is it something where maybe corporations or companies say, hey, we offer this testing or this technology for your benefit, but it's also just something that ensures that we're keeping our workforce as healthy as possible. I mean, there's so many questions that come up just even from one single point of discussion. So
yeah, I think from the technical point of view, this is like the ethical topic is always the points you mentioned, that we might have some control in terms of like prospectively like developing those kind of programs, but then from a technical point of view, we build algorithms mostly on retrospective data overall, and then those data also kind of bias, and the algorithms that we deploy might then work better on specific groups. So I think the ethical, it's a totally different conversation, I believe, like or a separate episode. I don't want to go deep into that, but I guess you guys, I haven't watched previous episode, maybe you have touched it even, like the bias from algorithms, which then enable good performance on specific population groups. Is it's going to be based on ethnicity, age, sex, or all these factors. This is an ethic problem in terms of the technology part, which I'm thinking about when you mentioned that. Yeah.
Yes, you'll appreciate this, and I've mentioned this to my colleagues before, but last week I was at Arizona State University. At least in the United States, it's the newest medical school. They begin in July, and I had an opportunity to be with the dean and the other professors, and the graduates of this new class. They will not only have an MD medical degree, but they'll also have a master's in engineering and a degree in business and specifically entrepreneurship. And I think it's reflective, their thinking, of our discussion right now, because you are at the intersection of, medical practice, right, working with clinicians, and then the science and the engineering. I mean, there's a lot of, in all of our discussion behind everything we're talking about is a lot of deep engineering capability. And I think it's very interesting that this med school, and I think others will follow, they recognize this now. And so they're training the future physicians and future physician leaders to not only understand medical, but also engineering and business. I think it's quite remarkable. I don't know if Europe has followed suit yet. Maybe they have. But yeah, I think it's just really interesting, given our discussion, that we're thinking along these lines.
Because you have to be able to understand what you're using, even if you're not the one developing it. It's, you have to have an understanding of it to know its limitations and its potential.
And I'll throw in some devil advocate here. If Dr. A knows the technology, can use it, leverage it, and can improve your health, and Dr. B, he loves medicine and is trying, but doesn't know, then what doctor would you want? You want the one that can really leverage, create, think outside the box, leverage AI, and I call it human plus AI, where it's going to elevate your game? Or do you want the doctor that's studying but can limit himself only by the books he or she reads for that time? And as we know, medicine is doubling knowledge every 72 days. Back in the 1950s, medical knowledge would double around every 50 years. And so it's really hard for the average person to just be able to keep up. So who would you want? And from an ethical point of view, can you argue in saying, dude, you're creating malpractice. You're actually hurting patients and you don't even know it.
Yeah, I think it sounds like I guess the challenge is always, like, as you mentioned, like the knowledge is moving so fast, and not just the end users, but like, let's say, even I believe you guys spend a lot of time outside your job to keep up with the tech also. And so maybe it also changes the landscape for new job scopes where they're going to be different. So I guess it's a really nice thing to see these study programs that Ed mentioned, but maybe there will be also new opportunities for job scopes where there's an intersection between like these technical people who understand the medicine and the technical part, to merge it with like practitioners. They really focus on patients' care, because I believe that also takes totally separate effort in terms of experience and year-long education. So maybe there might be a way to not put all that workload on one person, because it sounds like it's going to be too much at the end of the day. Yeah.
Correct. Well, I know we only have like 20 minutes, so if there's any comments in the comments, feel free to list them and we'll answer them. And then if not, I want to really take advantage of all three of us here. So I really want to maximize that last time. So if you guys, Ed or Doc, have any questions, just jump right in.
Well, I think what Harvey, it was very thought-provoking what you talked about. And, I'd be interested in your sort of thoughts on that. Like what would be the ideal? So let's say you conclude your research and it shows this great potential we've been talking about, how it's going to be so helpful. What would the ideal sort of clinic or hospital look like in the future that leverages the clinician and all of their knowledge and capabilities, as well as the technology? Like if you were the Minister of Health for Germany, and you knew about all these capabilities, how might you sort of reconstruct healthcare as a result?
Wow. Okay. I think so. I think the most, and that is like also very personal observation to see that. I mean, in general, people want to feel well cared for, and I think the main goal would be to create an environment where patient care and time to explain also certain conditions. So if we advance the field to understand certain things through precision phenotyping, for example, I think there's also substantial need to be able to explain those things also to the patient to understand what is happening. So I think a landscape that really create this space of care and explanation and follow-up, which is enabled through AI, taking over the kind of tedious jobs, running algorithms in the background, and then having experts to kind of bridge these outputs to, let's say, an intermediate or even directly also as a separate consultant to the patient. So there might be a specific consultant to kind of explain those new biomarkers in a very simple way, to depending on who he's talking to. I think the focus that would be ideal to have a healthcare system that really focus on that kind of communication pipeline as well. Yeah.
Yeah, again, I know we're an international podcast, so we don't want to focus just on the U.S. And that's why I asked the question, from your perspective, over in Europe. But yeah, that we're limited in, and I'm afraid I'm coming across like as a downer on America, and I'm not. That's not my intent. But we definitely have our shortcomings, just like we have great things that we do. And when I'm part of a health system as an executive, I'm able to get a full day. When I get a physical, it is a full day, and I have 20 or 30 tests, including the type of tests that you're developing, and I get all this access, and I get very personalized briefing on my healthcare and all the different things I can do. And I have a physician assigned to me I can meet with on a monthly basis, going back through all the statistics that we learned through this process. And unfortunately, right, it's limited to just, a very small subset. That's why I was asking about scalability earlier, whether it's geographic scalability or otherwise. And so that's just the hard part, is like, how do we enable this great technology and these great insights that are going to help people? How do we enable it for the masses? And so that's what my wheels are always spinning like that. And that's sort of the heart of my questions, because I believe in the technology. I understand completely what it could do for people. And I just want to see everyone be able to take advantage of it.
And Yeshi brings up a good point about, just how do we communicate this to our patients as well? Because I'm thinking, average patient visit time, even if I'm up to date on everything that's out there and able to leverage it and able to talk my patient through it, in a way that they can understand. I mean, how long would that clinic visit be? And, if we are here trying to provide access to care to every child who needs it, then how does that happen realistically? There's already a physician shortage, which is predicted to get worse over time. And who fills in the cracks? Like, where do we go from there? Perhaps the solution is to kind of almost have segmented parts of it where there's an expert who is there to communicate the nuances and the details to the patients, while we as the clinicians are responsible for the understanding and maybe the synthesis of the plan or the options for the plan. And maybe that's the direction it goes, but there's so much there that I think we will learn along the way.
I love where this conversation is going. My favorite phrase is, we don't know what we don't know, right? And leveraging this technology, we're able to elevate our health. And so I'm always beta testing myself, and I'm an N of 1. And I'm literally creating a little mini Jarvis that is constantly there, just telling me. This morning, I got a text saying, this is how much you slept. You didn't go to sleep like you normally do. You stayed up. It's because I was watching the Columbia game last night. And then it was saying, here's your deep sleep, and then here are your stages, and here's why you need to make sure tonight you get some rest. Now, what's really interesting is, I know you guys will be like, Harvey, that's too much, but that's okay. I have it check all my wearables, all my data. It has access to my emails, my schedule, all of it. And the day a couple of weeks ago, I was in Portugal, and I was in Boston the day prior. And before that, I was in Stanford speaking. So anyway, long story short, I got a text from my AI saying, Harvey, is there any way you cannot travel today to Portugal? You're not rested. Your HRV is down. You're sleeping. You're aging yourself. Delay your flight one day, get some rest, and leave tomorrow. And I'm like, oh my gosh, this is crazy that it's telling me that I'm running myself hard. So anyway, I thought, it didn't know what I didn't know. It's helping my health, and I'm using it.
And what did you do?
I did what every responsible person would do. I still
ignored
went.
it. Well, now I have to play devil's advocate a little bit. So say, like, you're talking about, when you get those messages about how your voice is, you're about to go on stage. Say your voice to you felt fine. Like, you felt fine. You weren't picking up on it, but your technology told you this. Is there a chance that it might even get in your head and you're like, oh, my voice is not good. Maybe I'm not going to sound as good. Maybe my presence is not going to be as strong on stage today. I mean, I guess there's that aspect of it too, that, sometimes when we have too much information, does it impact us in a way that we wouldn't have been impacted without it, and even like the fatigue thing. It's like, if something's telling you, hey, you're tired, then do you start to feel more tired?
Great question. And I'll bring it to home with patients. If our patients are wearing watches and the watch is telling them, you know what, you're not sleeping, and they get so obsessed with this thing that they start not sleeping because they're trying to track themselves, then for that particular person, maybe that's not the correct intervention. And I really hate to say this, but it's all about that individual. How are they going to process that information? For me, I'm like, dude, bring it. If I'm going to die tomorrow, tell me so that I know. That's just me. But other personalities like, oh no, Harvey, I would not want any of this information. And so I get the difference. But to me, I'm going to go back and say this other thing real quick. To me, anytime there's any dispute with anyone, it's about education. If you boil it down, if you're fighting with your spouse, fighting with your business partner, you're giving your opinion, that person's doing another person's opinion, and you're educating each other, hoping to find a resolution. And so to me, it's all about that. Education.
Well, and when you are trying to find a resolution, it's not always about one person winning the argument. It's not always that, one person is right in that situation, one person isn't. The education piece hopefully puts things together so you realize where the compromise is. You realize that both people may be contributing valuable input, and maybe there's another solution in there after educating each other that actually is a third, avenue to take. So I think that is a good point too.
I think to loop that back to the initial question about the ideal situation, how this will transform healthcare is like, if there are specialists and there are certain paths for patients, I think with these AI solutions, it's also quite a great opportunity to kind of bring in new opinions that merge and find compromises. Just a thought based on the example you were giving.
I'm sort of hesitant, like when we do personal anecdotes, because I know they're all one-offs. But I recall, so I had a situation. I'm an athlete, number 2 in the country for my particular sport, and I remember going through a battery of tests because I actually had an LAD in a race, and I finished the race, and I still made Team USA. But the point, and there's a lot of tech involved, but what I'm trying to get to is they did a ton of tests. And I went through an all day battery of tests. And at the end, and I'll never forget this, it's Dr. Dermot McPhelan. He's a star, cardiologist that takes care of many high profile athletes. And he asked me one question at the end of all that. He had this whole treasure trove of data. He asked me one question. He said, "Why do you race for Team USA?" And I broke down crying, and he said, "Go race." To this day, I have no idea what the statistics, what all the data showed. He didn't need to tell me, So there's that balance. It's great to have the data, and I'm a huge believer in it. But I love the fact how empathetic he was and how he just got to the heart. Like, what's important to me, what's important to the patient. It's not always the data. It's like, what drives you, what brings joy. Joy is not necessarily having a ton of data. It could be for some people. And so it's up to that clinician at the end to realize, understand their patient and what's best for them. How do they want to receive news? And so who knows? I could be at 99% risk factor to have another LAD during a race, but I'm having the time of my life.
And that's what Harvey mentioned is the human plus AI component. It's always together, it has to kind of go together.
Exactly. And that's where I say, let the doctors be the empathetic. Let us give that compassion. And I know I'm going to sound a little crazy here, but I really think we have energy. I think we love on our patients, and we're in part giving that to our patients, and we're helping elevate them because we care so much. And I know that sounds odd for some people out there, but I really believe in that power of touch. I tell nurses, do not call me by my first name when we're in front of a patient. Not because I need to be called doctor, because I feel like you're going to take away that emotional state where the doctor and the patient says, "Oh my God, Dr. Castro put his hand on my shoulder and said, everything's going to work out. Everything's going to be fine. We got this." Versus, "Hey, Joe, come on in." Like they just degrades me. And again, it's not about the name, but it's that power that Ed's talking about. And I really think that's what we need to channel into, in the sense that it's human plus AI, like you just said too.
Yeah.
And we do have a question, if you want to lift it up, from Jamal, we can just kind of talk about it. And we got like 5 more minutes. I think it will become as important as ever as the medical practitioner have peer-reviewed as content published and made accessible to AI. Since AI is leveraging knowledge humans create, review and validation is important to make sure we are not poisoning the knowledge well. I'm trying to read it off the thing. Yeah, that's it. So yeah, totally agree. Because that's one of the issues we're having right now. If AI is getting into our medical literature, and let's just say some of it may be garbage and it's not being reinforced by the doctor saying, this is correct or not, then we're putting garbage on top of garbage. And so that line of data could be totally off. That's where we need us.
And is that where like our medical societies come in, like the American Academy of Pediatrics, where we have standardized protocols for treatment plans and things like that? It's like there is accountability within the organization that, hey, what the recommendations that we're putting out have been reviewed. And I think that's something where that has to be extended to AI and what's available. It's on us to kind of, as on an organizational level, at least be aware of what's there and make sure that it's accessible even to the practitioners. All
right, we got 5 more minutes, so let's end it in a high note. And every person, I like to just go around, and then I don't want to ask a question. I'd rather you add anything you want to add to the conversation to end this with. So if you guys want to start, just anything that comes to mind, just to kind of throw it out to let our audience know. So who wants to start?
Well, I think iron sharpens iron, and I love the fact that we have all these great scientists, researchers, entrepreneurs, innovators working with clinicians and tech people or whatever, digital people, and really working together in a synergistic pattern to develop new therapies, to develop new discoveries that will just help other people in their journey. So Yisha, I'm so happy that you are with us, that you were born, and that you're doing the things that you're doing. You have the insights that you're doing, because I think you're going to help change the world. So thank you.
Good. Yisha, do you want to go next?
Yeah, thanks a lot for the invitation. I think I haven't said that at the start, so I'll say it at the end. Great opportunity to be here, and I always like to have these kind of conversations, see also kind of how it brings me forward. So thanks a lot.
And I'll just make a comment about balance. We're talking about all these amazing potential, technologies that may become implemented, in our near future. But to take it back, there's something also very healing about going outside and, being in the sunshine and, putting your bare feet in the grass and putting good food in your body. And I guess I just want to kind of bring that back to our attention too. It's like all of these things are amazing, and I'm so grateful to be having all these conversations, but it also doesn't replace all the things that we have known and experienced for centuries. So just a reminder to keep that balance in mind.
Great. And for me, I like to start at the bottom level and say, everyone listening, whatever pearl, whatever you learn, share it with someone else. Obviously, come to our podcast and listen. But more importantly, what can you do with that knowledge that you learned today to help humanity? What can I do as me, that human, plus AI? What did I learn so I can elevate whatever that is? And for us healthcare physicians, it's going to be our patient. What can we do to help that person? And with that positive note, I want to thank everyone on the panel. Thank you for coming, and I really appreciate it. And then we're going to end the podcast, and then I'm going to ask people to stay just to make sure that it uploads. If we have someone in the background, if they want to end the podcast, I appreciate it. And then on the